Hello and welcome to anyone who is trying to learn about the meningeal layers and how they interplay with subdural and epidural hematomas. This is my first video that I've ever made on YouTube. I don't know what I want from this account, but I hope that the videos that I do actually put out can be educational to anyone, whether you're in medical school, undergrad, high school, or not in school at all, because it's good to keep learning, even if you're not in school. Doesn't matter where you are in life. So anyways, let me start off with discussing our meningeal layers first. So we're going to start off with our dura mater. The root of the word dura mater comes from hard mother or tough mother, something like that. And it's basically named this because this is a dense slash hard covering, and it's made of dense irregular connective tissue. It sits right below all of the layers of the scalp, and so the bottommost layer of the scalp is gonna be your cranial bones, which are covered. Let me find a better color. They're gonna be covered with something called periosteum. Bones in the body are all covered with periosteum, which is it's a supportive fibrous tissue that contains blood vessels and innervations for the bone that run into the bone. Basically, it's supportive tissue, but this is important for the dura because the dura can be broken down into two different parts. You have the periosteal dura and the meningeal dura. The periosteal dura is the part of it that sits right up on that periosteum of the bone, and then the meningeal part sits on the rest of the meninges. But yeah, so now moving on into the arachnoid mater. It's called arachnoid because you can see how there are all these little spider-like projections that come off of it. And this, where all these spider-like projections come off, this is called the subarachnoid space. This layer it's the middle covering of the brain for the dural layer, for the meningeal layers, and it's made up of loose, irregular connective tissue. This is also an important layer because, let me find my red pen. I'll make you guys a blood vessel. Blood vessels run inside the subarachnoid space before they go down and can dip into the brain. This is the brain, by the way, in case you didn't get that. And when we have our sulci, you can see how the arachnoid and our next layer, the pia mater, how they also dip down into those little sulci in the brain. The pia it's the innermost covering of the brain, and it is made up of loose connective tissue. Okay. It's hard if you're dissecting a brain, you're not going to be able to take off the pia mater. You can remove and reflect the dura, and you can visualize the arachnoid, but it's going to be almost impossible to actually see the pia unless you're looking under a microscope. There are also parts of the brain where the meningeal layers will dip down. For example, in the separation between the left and right hemispheres, you have the falx cerebri. So this separates the left and right cortex. This isn't necessarily the best drawing, but this is a vertical dural fold. It's not important to know it's vertical. I'm just putting it in there so you can understand my drawing a little bit better because I think it's kind of hard to say. And then we also have the tentorium cerebelli, and this guy separates. It's horizontal. It separates the cerebellum from the cerebrum. So the cerebellum is that little guy that sits kind of in the occiput area of the head, and then above you have the cerebellum. That's the big part of the brain. If you're a med student, that's obvious to you, but for anyone else watching, it might be an interesting thing. And these dural folds attach at the crista galli, which is a part of the ethmoid bone. Okay, so now I'm going to get into talking about the different hematomas that we can have. I'm going to talk about epidural and subdural. I'm not talking about subarachnoid for now, but yeah, so getting into the epidural hematomas, commonly caused by a rupture to the middle meningeal artery. This artery can rupture easily because it is below the pterion. I definitely butcher that, but this is the thinnest part of the lateral skull. And so if someone takes a blow to the head, or if they take a fall on, say, a sidewalk or down the stairs and hit their head on this spot, they can easily rupture that middle meningeal artery. And once the artery ruptures, it will cause blood to fill up in this epidural space. Commonly, patients will have a loss of consciousness initially upon hitting their head. Someone falls and they pass out immediately. Usually that would be caused by any sort of neurological trauma. And then once they come back to, they'll have a lucid period. And during this lucid period, they'll feel fine, nothing's wrong. But as that blood is building up in the epidural space, as the blood builds up in the epidural space, they eventually will start to deteriorate rapidly because of the pressure and swelling that's on the brain. And the brain has nowhere to go being in the skull. So that compression will cause, again, neurological symptoms such as, could be loss of consciousness, seizures. More common ones might be nausea, I think I spelled that wrong, vomiting, headache, etc. CAT scan will often show biconvex hyperdense blood collection, and this does not cross suture lines. Moving over into the subdural hematomas, these are usually caused by a rupture of these bridging veins, which they essentially bridge the gap between the superior sagittal sinus and the brain. But if they rupture, they can cause a subdural hematoma. So you can have venous fluid that builds up in that space between the arachnoid mater and the dura. Again, the causes for it are going to be similar to epidural hematomas. So trauma to the head would more likely be trauma to the top of the head than to the side of the head, just because of the location of those bridging veins. In addition to trauma, it can also be caused by chronic things such as cerebral atrophy, increased age, which these two usually go hand in hand, chronic alcohol overuse, and it can also occur in shaken baby syndrome. On CT, subdural hematomas commonly will cross suture lines of the skull, and you might see a midline shift of the midline of the brain. All right, thank you for watching my video on the meningeal layers and subdural and epidural hematomas. There might be more to come. We shall see. But thank you for watching.